Okay. Are you guys able to see me on camera?
Now we are, yes.
Yes.
Oh, perfect. Okay, it's not showing on my end. I just wanted to make sure you guys could see my face, period. So I want to thank everyone for joining us, the Citywide Council for District 75 Outreach Committee meeting today. We will now call this meeting to order at 2:08 p.m. Interpreters, you now have the floor to give your instructions. Spanish, you may begin.
Buenas tardes, el día de hoy si quieren escuchar la reunión en español, por favor llamar al número de teléfono 347-966-4114 y poner el código de acceso 880-994-757. Repito, para escuchar la información el día de hoy en español, por favor llamar al número de teléfono 347-966-4114 y ingresar el código 880-994-757. Gracias.
Thank you. Mandarin, you now have the floor to give your instructions.
各位下午好，如果想要收听华语翻译的话，请拨打电话号码347-9664-114，并输入今天的密码是33324104，然后按井字。如果想要收听华语翻译，同时留在这顺会议室上，以便在电脑上收看会议。请把你的电脑和电话都调到静音，然后在你的电话上输入会议专线，重复一遍。华语翻译的会议专线电话号码347-9664-114，密码是33324104，然后按井字。谢谢 ，Thank you。
Thank you. Bangla, you now have the line to give your instructions.
আসসালামু আলাইকুম, আমি বাংলার জন্য অনুবাদ করে দেব। যদি কেউ বাংলার মানে ইংলিশ না বোঝেন, বাংলায় আপনার অনুবাদক লাগে, তাহলে আমাদের রুম আছে, ওই রুমে আপনি ফোন থেকে কল করলে আমাদেরকে পাবেন। তো আমাদের ফোন নাম্বার হচ্ছে 347-966-4114, 347-966-4114। এটা হচ্ছে ফোন নাম্বার। এই নাম্বারে কল করে আপনাকে আইডি দিতে হবে 361-730-10, 361-730-10। আমি যদি আপনার যদি নাম্বার আবার লাগে, চ্যাটের মধ্যে মেসেজ করলে আমরা আপনাদেরকে লিখে দেবো, কোনো সমস্যা নাই। ঠিক আছে, আসসালামু আলাইকুম। ডান।
Thank you so much. One moment. There was an additional echo. Apologies. So we are excited about our workshop today. This is something that's been close to our hearts, as we want to make sure that we continue a great relationship with the NYPD and also give a lot of resources to our parents when it comes to resources, knowledge, and awareness around crisis and mental health and distress. I've been working with Detective Gallardo and Assistant Commissioner Dr. Brooker to bring these available resources to our parents and our care managers during crisis. Our hope is that our community understands how the NYPD is here to support, in addition to the web of interconnected resources. With that said, I would like to introduce Assistant Commissioner Monica Brooker, who is a licensed clinical psychologist, who will introduce our panelists for today. Thank you all so much again for being here, and Commissioner, you now have the floor.
Thank you. Of course, I have to thank you for making all of this happen. We are so happy to have this conversation. Our narrow focus today is around the teams and how to mobilize those teams and to give you information. It's the beginning of a larger conversation, so I'm excited about that. With me, I have Amber Trinkle. She is the SPOA manager for NYC 988, and she's going to tell you all about that because that really is the umbrella for, you know, tapping into a lot of these crisis services. I also have with me Veronica Olaya. She is the director of the co-response unit. One thing to know about co-response is that it is a partnership between DOHMH and the NYPD. And so they actually live here in the building with us, and they're going to tell you all about the program. So Director Olaya is with us. I think he was informally introduced already. Detective Gallardo has been with this unit since it began. And so he brings a wealth of experience and knowledge with him. And with that, I'm actually going to just turn it right over to you, Detective Gallardo, to start the presentation. Or should I be turning it over to Amber? Amber,
Thank you.
NYC 988, all yours.
Hi, everyone. I'm Amber with NYC 988. I'm going to go ahead and share your PowerPoint. Can everyone see that?
Yes.
Perfect. So again, I'm Amber with NYC 988. I work with the mobile crisis teams with and 988 was supporting the mobile crisis teams. So 988 was formerly known as NYC Well. So you may see those names used interchangeably, but we are the same agency. So this is just a quick overview of what we'll be discussing today in the NYC 988 portion. We're just going to go over the history a little bit, some of the numbers, and then what 988 can offer you and your family and your community. So 988 is a crisis lifeline. It was formed by SAMHSA and the former Mental Health Association of New York City in January 2005. At that time, it was formed to be a 24-hour, 7-day-a-week crisis line where people could reach out to a local crisis center to get free and confidential support. As the service was formed, we were able to add a Spanish subnetwork and a disaster distress helpline and veterans line. In 2020, the National Suicide Hotline Designation Act was signed into law, and that's what designated the 3-digit code for the lifeline. So in July 2022, we were able to fully transition over to that 988 number, right? And that's why there's this new line of 988 Suicide and Crisis Lifeline. This is just to make it easier to know, right? No matter where you are in the US or Canada, you can call 988 and get support. And that way it's easily accessible. So 988 currently is made up of 220 local contact centers across the United States. When you reach out, you'll be connected to a counselor who's trained, who can provide immediate support and connection to ongoing care. We're available via phone, chat, text, or video phone. Services are provided in English and Spanish. However, if you do need services in a different language, you're still encouraged to reach out. We do have a translation service that we would be able to use to help make sure that you gain support and are able to get the support through 988. There are also some specialized lines. So these are for our veterans. There's a video phone line that's available for deaf and hard of hearing clients who are ASL users, and LGBTQIA+ youth and young adults. So what that looks like is if you give 988 a call, you're going to be given an option to press 1 for the veterans line, 2 for the Spanish subnetwork, or 3 for the LGBTQIA affirming counselor. If you don't press any of those, you'll be directed towards your local crisis center. And if for some reason that crisis center is experiencing really high volumes, right? Maybe there's something going on in that area, so there's more people calling at that moment, you may be directed to the backup center. And this is just to make sure that you're not sitting on hold for an extended period when there's a crisis, when there's support needed. So no matter what, you will reach a trained counselor. It just depends on which option you pick in that moment. So NYC Well officially became NYC 988 in September 2023. We transitioned to just help make it easier with the name. Again, it's the same name everywhere you are in the United States, to assist with remembering. Okay, and we provide very similar services to 988 at large with a few extra services as well. So we're still a free confidential service. We're available 24/7, 365 days a year. So you can reach out to us at any time, any day. And we're still available via talk, text, or chat, right? So any of those ways, please reach out to gain that support. If you need it for you or a family member or a friend. NYC 988 does serve as the mobile crisis single point of access, which we're going to talk about a lot later. We also offer warm transfers to referrals. So this is something that a counselor would do during a call. If you've identified that there's a service that you want to work with, they can assist in connecting you to that service in real time so that you can speak to a provider and hopefully get an appointment set up or get the next steps figured out. We also offer follow-up services, and this is something we offer to our callers to ensure that if we provided referrals or if we provided support, that if something didn't work or if you needed more support later, that we could help assist. So NYC 988 will give a call back if you agree to it within 24 to 48 hours, depending on your availability and your preference, to just go over what happened, if you needed anything new, or if you needed any further support. We also have a public service, a public facing service finder, which I'll show you in a couple minutes, and a peer support one line. So the next few slides are just going over our numbers from 2022. In general, the majority of our interactions are via call. So we have about 3/4 of our interactions are people reaching out by phone. We did receive about 1/4 of our interactions via chat and text. But all types are encouraged, right? People have different reasons. A lot of times clients may feel that the chat and text gives them a privacy if they're in a space where they can't talk privately. So whatever works for you, we have that available. A question we frequently get is, can I reach out for this, right? Is this presenting concern a reason to reach out to NYC 988? And as you can see, we have a vast array of reasons that people reach out. So in 2022, the most common reason for someone to reach out was due to a stressful life event, right? Things like anxiety concerns, mood concerns, interpersonal concerns were also really high of the reasons that people reached out. Suicidal ideation was actually our 5th most common, right? So we can present with any type of crisis, any type of mental health concern, and still reach out for support. We're really here to support with any concern. That other that's listed here may cover things like COVID-related concerns, mobile crisis referrals sometimes, or someone just calling for some information, right? Okay, in 2022, the majority of people who reached out were reaching out for themselves, but we did have about 9% of our callers reach out for a friend or relative, and about 6% reach out as service providers for their clients, right? We do encourage callers to reach out, again, in any situation. So you may be reaching out for yourself, but you may also be reaching out for your child or, a friend's child or a friend's child's parent, right? There can be a lot of different reasons that you would be reaching out, and all of those are valid. We can offer support both for you and someone that you know, or if you're a provider for your client. So this just goes over the peer support line. This is something that we're really proud of at NYC 988. And what our peer line is just a line that's offers trained peer support specialists who will offer a call to discuss and support to discuss what concerns are going on, and they're able to use their lived experience and share to help figure out how to manage those concerns. For this, our peer specialists' own experiences relate back to mental health, substance abuse, or disordered gambling, and they can share, like I said, their experience to assist in how to cope with your own experience. This is a great support both for people who are calling for someone else and someone who's also calling for themselves, right? If this is something that you would want, you would just need to call 988 and let the counselor know that you wanted to speak to a peer. The counselor may have a question or two for you first, just to, make sure everyone's safe and make sure there's no support needed by that counselor first. But once you're done with the counselor, they will go ahead and transfer you over and get you that support as well. So when to consider calling NYC 988? These are just 5 examples, right? There are so many reasons to call NYC 988. Some major ones that we would consider a good reason to call 988 is alcohol substance abuse, anxiety, depression, mental health concerns, suicidal thoughts, stress related to finances, work, COVID, family life. But some things that aren't listed on here are also behavioral concerns at school. If your child is experiencing behavioral concerns, if your child is experiencing a sudden school attendance concern and you need support in reference to this. If you're trying to connect services in the community and you're struggling to do so. Those would all be reasons to call NYC 988. We're able to really support with any mental health concern or concerns related to mental health. Do always want to stress that if there is an imminent crisis, that we do encourage you to call EMS. So that would be if there's something immediately happening where yourself or someone else would not be safe in the time it takes to call NYC 988 or the time it takes to have an MCT team come out to you. Those would be situations where we would encourage you to call 911 or EMS instead. So as I specified earlier, we are the mobile crisis team, single point of access. And what this means is that the referrals for mobile crisis teams in New York City go through NYC 988. And this is just to make it easier, right? We do have 19 adult teams, 5 children's teams, and 1 co-response team throughout the city. So, if you had to call each team individually, that could be a lot of work. That could be very exhausting. So having one place to call is meant to make it easier for you if you're trying to gain support for you or someone else. When you're reaching out to NYC 988, you may know that you want a mobile crisis referral. And if you do, please feel free to let us know so that our counselors know to assess that and offer support in that way. But you may also, discuss mobile crisis in a situation where you weren't sure that that's what you needed, right? You can reach out and just know that there's something going on that you're concerned. Or a provider may reach out and say that someone's missed appointments and they're not sure what support's available to this client. In these situations, a counselor is always going to engage you and talk to you and try to figure out what is going on for you, for your family, for the person that you're concerned about, to try to figure out what's going to be the best support. And when they do this, they're going to have some questions, right? So they're going to ask about, what's been going on? How long has this been going on? How does your child or family member, friend typically, engage, and how do they typically function day to day versus how are they functioning now? And these questions are just meant to give us an understanding of how your person that you care about is presenting on a day-to-day and what services may best support them, right? So the counselor is going to assess, does this meet criteria for a mobile crisis referral? And if so, what team would be the most appropriate based on those questions, right? Once they finish asking questions, once you finish sharing what your concern is, the crisis counselor is going to work with you to make a plan about what's next, right? When you leave an NYC 988 call, we want you to leave with a plan of how to support yourself, how to support the person you're calling for, to make sure that you have that plan and that connection, right? And that may be an MCT team, but that may also be a lower level of care, which might be a community mental health practice, reaching out to their current provider, or that may be a higher level of care like EMS or the hospital if that's what's needed, right? No matter what's happening on the call, this is going to be a collaborative discussion. The counselor will keep you involved. You have an opinion and a say in what service gets recommended and what referrals get accepted or provided. And then you should be offered follow-up, right? Which this would be an option where NYC 988 reaches back out to you in a couple days to just follow up and see how the intervention went. Okay. So like I said, with the interventions, we have that lower level of care, the children's mobile crisis team, adult mobile crisis team, which also includes co-response in this chart. and then a higher level of care. So what is mobile crisis? So mobile crisis teams use face-to-face intervention with the identified individual in crisis, as well as their family and other support systems, to engage, assess, de-escalate, and connect an individual to the most appropriate services. The goal is to help resolve the crisis situation when possible. These services are provided in the environment where the client feels comfortable, right? So the client's home. And that maintains that it's least restrictive, right? So if we're in the client's home, that's somewhere where they're comfortable. We're not taking them to a hospital unless that's needed, which is the goal. For children, this service can also occur in the school, as long as the school is making the referral and the parents consented, right? So we do need parental consent for the team to go to the school, and that's just because it's not the home setting, and you know, the parent may or may not be there. We do want that parental consent. One thing that the teams will do when they're out and providing services is they will attempt to provide additional referrals, link the client to any necessary medical or behavioral health services, so that when mobile crisis team referral closes, since it is a short-term intervention, that your client, that your family member, that yourself will have the support you need for the long term, right? Teams are available 7 days a week. They're open generally from 8 a.m. to 8 p.m. Some teams do have reduced hours depending on the location. A crisis counselor would go through that with you when you place the referral, and as part of making that plan, we'll figure out, you know, when the team is coming out, does that time make sense for you, right? If there's any concerns or any issues with those times, we would just let the mobile crisis counselor that you're speaking to know, and they would note that in the referral to the team. Even though the teams are available from 8 to 8, NYC 988 can take referrals at any time. So if you think you need to make a mobile crisis referral and it's, you know, 1 a.m., please feel free to call. We can place a referral. We can go through that information. The team just won't be out to reach out until the next morning. So when do you request a mobile crisis team? So mobile crisis criterion includes that it's for a non-life-threatening situation in which a person is experiencing an intense behavioral, emotional, or psychiatric response that may be triggered by a precipitating event. This person may be at risk of harm to self or others, disoriented or out of touch with reality, functionally compromised, or otherwise agitated and unable to be calmed. And if this crisis is left untreated, it could result in an emergency. Right. So these situations, this can look like situations where someone is really depressed, right? Someone is experiencing a really intense anxiety. Maybe someone is experiencing a lot of behavioral concerns at school that day and is unable to regulate. Maybe moments of aggression, right? If you're not sure if the situation fits under this criterion, please call. This is what the crisis counselors are trained to do at NYC 988. They're going to go through what's going on and try to figure out if what you're experiencing would benefit from a mobile crisis outreach. Two other criterion that we always take into account is that person's willingness, right? So if you're making a referral for your child or for a family member, is that person willing to seek help, right? And the reason that we assess this is we always want to make sure whatever support we give you is the least intrusive, right? So if somebody is willing to, you know, go to a service themselves and, you know, go to a community mental health practice, we may look at that lower level of care first before looking at MCT if they're able to provide that support. Now, if someone's unwilling or unable to seek help, right, either on their own or with the aid of a family member, then MCT may be the most appropriate because they can come into the home and get that support in real time and hopefully connect someone to that support for long-term care. There may be situations where someone's connected to care, so your child already has a provider or your friend is maybe connected to care, but they would benefit from short-term support. So we can still do mobile crisis in these situations. This typically covers situations where someone's maybe on a wait list, right? So you've gone through the process of connecting your child to care, but it's not for 5 weeks, right? It's, you know, there's longer wait lists and they're struggling. They need that support beforehand. Mobile crisis can come in and offer that interim support until that service starts. That way, there's not any further decompensation or any further struggles that would make it harder for them to connect with that service in a couple weeks. Some common questions we get is, again, can we take referrals when someone's connected with a provider? And like I just said, the answer is yes. So we can always take that referral. What we're going to look at is, can that provider provide support first, right? So if your child's connected to a counselor or you're connected to a provider, would it make more sense to involve them first before looking at pulling someone new in, right? And that's because that person is going to know you, they're going to know your family, they're going to potentially be able to provide that quicker support in that time. However, if your child's missed appointments and is unwilling to attend the appointments, or if there's some kind of gap in care, MCT would still be able to work with them in those moments. The other one is, again, if someone's connected to ACT, FACT, SPECT, or IMT teams, this is very similar to the last answer, which is that we can make the referral, but we're going to talk about it. We're going to figure out what's the best support for you and your family. Again, we want to make sure the service that's there is a service that's going to be able to provide support. So this just goes over some information that you may need. If you're calling for your child for a mobile crisis referral, or yourself, a family member, you most likely already know all of the information we're going to ask. Our counselors will ask information about some background information about what's going on, what your concerns are, your name, the person that you're concerned about's name and address. If you're making it for someone else who you're not related to, or you don't know quite as well, maybe a neighbor or a parent of another student that you know, you may want to just make sure you have this information because it may not be something you always have, right? So this would be things like address, name of why, a name or way for the staff to identify the client. So if you are making a referral for someone, we do really like to know the client's name, and this just helps the team when they're outreaching the client, so that they can make sure they're talking to the right person. They can give that support. If for some reason the person you're making a referral for, you do not have the name for, maybe they are a neighbor and you only have a first name, or you have a nickname, or again, they're a friend's parent, we can still make the referral. We just need a way to identify them. And we'll take as much information as we can, right? If there's ever a question you don't have the answer to, that's okay. The counselor will note that and figure out what service can be provided based on the information that we know. Some other questions that they'll talk about is, again, what's the current crisis, right? So describing the situation. How long has this been going on? Has this been getting worse? Are they linked to any other services? What impact is this having, right? So is this impacting their social functioning at school? Is this impacting their home life, right? Is this impacting their ability to work if they, also work? And then are they having any thoughts of killing themselves, or are they having any thoughts of killing anyone else? To make a referral, you don't actually need consent to make that referral. You can make a referral for anyone, your child, again, a family member, a neighbor, and you don't need their consent. But those referrals cannot be anonymous. So when you do call to make an MCT referral, it is important to know that we would need your name and information. And that's so the team can reach out to you. They do reach out to you when following up with the client to try to get any additional information and, make sure that they know what's going on. Another area that mobile crisis can assist with is crisis residential treatment referrals, right? So within New York City, there are some crisis residential treatment programs. When you're applying for this would be something that needs to be completed by a mental health provider. If this is a program that you qualify for, or a program that you're looking into, and you don't have that mental health provider to make the referral, we just need to give NYC 988 a call, and we will connect you with a mobile crisis team to make sure that someone can assist in filling out that referral. So one of the resources that we have that is really great is our public service finder. I'm going to go ahead and just show it to you on the actual website because I think that's more helpful. Can you still see my screen? I'm going to take
Yes.
that.
Yes.
Okay. So if you're on our website, right here, it has Find Services, right? So if you click on Find Services, it's going to bring you to a screen that you can say what you're looking for, right? So say you're looking for counseling. It's going to pull up different counseling in your area as well. But what I really like about this and what I think makes it really useful is that there are different filters, a way to just make it a little more specific to you. If you know what you're looking for, you know what you're looking for your family member, you know, so that you're not going through all these ones that don't apply. So you can select an age, right? So say you're looking for something for your child, you want someone who specializes with children and adolescents, you can go ahead and select that, and that's going to filter that more, right? You can select a borough, right? So let's select the Bronx because it's first. So it's going to, again, show us options that are just in the Bronx. You can select payment information. So this has free services, sliding scale services, and then different insurances, right? So you can select whatever your insurance is, or again, free or sliding scale, so that, you know, whoever you connect with is someone who's going to be able to provide those services. And you can go ahead and select different program focuses, right? I like using the program focuses when I'm looking for stuff, just to help kind of think of what words or what services you might be looking for in those moments, right? And we have a full list of different things. You know, something that can be really useful is that co-occurring, right? So if there's more than one concern going on. And once you do that, once you kind of fill that stuff in, you just search, and you can either use that map feature or scroll down the list. And it's going to give you a summary of the service, their address, a link for it, and a phone number, right? When you actually click on it.
Amber, quick question. Are you showing a different screen outside of Find Services right now?
I am. Okay, let me change the sharing screen. I must have it set wrong. Thank you. You see?
Yes.
Yes, now we can see it. Okay. So I'm sorry about that. So right here is the screen that it first takes you to. If you go to our website, I'll just start over. If you go to our website, you would click on this Find Services, and this is where the database is, where you can look at everything I just described. So you'll go ahead in this I'm looking for help with and put in what you're looking for, right? So say you're looking for counseling. You could search counseling, but you can also add those filters that we were talking about, right? So there's the program focus, where you can, you know, specify it a little more, right? So maybe you're looking for a program focused for children, or a program focused on, you know, the LGBTQ community, SMI, right? So you can pick whatever things feel like they apply, right? Again, you can pick payment information. So it has many different insurances listed. And then at the top, we also have free if eligible and sliding scale. And then you could specify age and borough, right? And this just lets you, again, figure out what services are available. This is a list we keep current. Our resource team is very active with this list. So everything in here is confirmed twice a year, I believe, but it may be quarterly. I may be wrong with that. But the phone numbers and addresses and web address are regularly checked. So you can always do this yourself. You can also call, we can go through it with you. Another online resource that we do have is an app library. This can be really good both for your own coping, but also coping for a family member, a child. And this app library, all of these apps have a primarily free component. There may be some paid features as well, but everything listed here in general can work for free. And they're just different apps that can assist with coping, right? And we describe what it is. So if you're looking for something for anxiety, or you're looking for something to help with stress, there are different ideas here to just help as that option. I'm going to go ahead and go back to the PowerPoint. Can you guys see this?
Yes.
Perfect. So this just describes what we just went through in the app library. And a last resource that I always like to share is mysafetyplan.org. And this is a great resource for providers or even for people who are currently experiencing suicidal ideation or passive suicidal ideation. And what this will go through is it'll go through creating a safety plan. But what I really like about this safety plan is it gives you the option to text the safety plan to yourself. So if at the end of it, you want a copy of it, you don't have to write it all down on a piece of paper, which can be hard to get, get people to do in those moments, especially, if you're struggling or distressed, right? It also makes it easier to remember, right? If we have a text with it, we can download it on our phone and we have it whenever we need it, right? So it'll go through your warning signs and just different components to help increase that safety and help make a plan of how to keep you safe. This is a resource that our counselors will use at times when someone needs a safety plan. So again, they can send it to the client, but it's also a public resource that's available. So you can use it at any time or you can use it with clients at any time. So again, just another example of how to contact us, right? So you can call 988 and select the appropriate option or text. It does have the text there listed for Spanish or for the LGBTQIA line. And the chat is available through our website. Okay, that's just my information. If you have any questions later, I'm going to pass the mic back to Dr. Booker.
Wonderful. Thank you so much, Amber. That was informative. We're going to talk about the safety plan even more. So I'm excited about that later on. I'm going to jump right over to Detective Gallardo and let him start talking about co-response. What we're hoping to do is to keep this within about 60 minutes, so there's plenty of time for questions and answers. And with that, I'll turn it over to Detective Gallardo.
Good afternoon, everyone. My name is Detective Gallardo. Very quick story about myself. I have been in the law enforcement field for 10 years and a half. And I have been in this unit for 8 years and a half. And I could honestly say that I love the work that we do. I love the work that we do with the Department of Health and Mental Hygiene. And I could honestly say that every officer and every clinician in this unit, we strive to go out there and, perform our best and help members in the community. So today I am responsible to facilitate a part of this presentation. Christy, thank you so much for having us. So I will speak. Do you guys see my screen, by the way? You guys see my screen? Okay.
Yeah.
Okay. So the co-response unit is a collaboration between the NYPD and the New York City Department of Health and Mental Hygiene. We serve community members presenting with elevated mental health or substance use symptoms and individuals that are at risk of harm to themselves or others. So just like Amber stated in her presentation, you know the individual that you're referring to NYC 988. If they're referred to co-response, we are the type of team to go out. And if you see that they're kind of like, behaving in a certain way where they're not acting the same, if they're presented in a way where as their parents or as a loved one that they are that they need some type of help and some type of assistance, we are the team that will go out if they qualify, right? We're our crisis team. So we go, we intervene, we conduct an assessment, and we try to connect them to the services that they need. We tend to, and you learn that later on in the presentation, we don't want people to get arrested. We don't want people, to get hospitalized if they don't have to, right? And we're also a post-crisis team. We do a very good job creating a plan for an individual, make sure they get connected to the services that they need and that they are comfortable and that they are happy with whatever services we tend to connect them with. So that's very important. So the co-response unit's mission is to assist and connect community members to behavioral health services. Co-response strives to help individuals remain connected in the community and reduce their interaction with the criminal legal system. The program serves community members ages 18 and over and that are residing in the 5 boroughs. So we do only deal with individuals that are adults, 18 and over. We have the flexibility, which is amazing, to travel to all 5 boroughs, right? So if you do actually make a referral and you're in Brooklyn or you're in Far Rock, we have the ability to actually go there And if the case is actually approved, we could get there with anywhere between 24 to 48 hours, which is amazing. Okay. What are some of our main goals? All right. So some of our main goals is to reduce hospitalization and interaction with the criminal justice system for individuals experiencing a mental health crisis. All right. Clearly, I represent the NYPD. And I could honestly say that an individual that is suffering from mental health crisis, taking them to jail is really not the way. They're not going to get the help that they need there, right? And I think our main goal is to connect them to a service provider that's going to help them, improve. It's going to help them move past the crisis, right? A team that's going to be there for them 24/7, a team that's going to be that support, that is going to prevent them from actually going to the hospital and or have any type of criminal justice interaction. All right. So just like I said, we tend to improve an individual's quality of life. That's our goal, and assist past the crisis. Hospitalized individuals at an elevated risk of harm to themselves or others. Now, this is highlighted red because bullet point number 3 is a contradiction to bullet point number 1, and it is, right? But at the same time, if we go and if we go see an individual that was referred to us, and we deem them to be they're not in a safe space, or they're a danger to themselves or other, then we are going to take them to the hospital just for an evaluation. All right. I think the one beautiful thing about our unit is that we could take our time. We're not in a time crunch. We will go there if we have to spend 3 or 4 hours conducting an assessment, getting to know that individual. In 8 years that I've been here, we've never had a bad experience taking anybody to the hospital. Our goal is to establish that relationship with the individual refer to us, and they allow them, most of them, 95% of them that we interact with, they actually have a good rapport with us, which is amazing. All right. And our ultimate main goal is to connect individuals to appropriate long-term services in the community. All right. It's just not the hospital, and it's just not, the criminal justice system. And this is why I love that Amber started the presentation. There's so many service providers in the city. There's so many service providers within the 5 boroughs, right? So, and it all falls on the individual that you guys are referring to us. If they're willing to help themselves, if they're willing to engage in the assessment and if they're willing to hear us out, we could work wonders, right? We could connect them to a team that's going to get them the help that they need, which is amazing. Okay. So what are some of our day-to-day operations? So the core response unit, we work Monday through Friday, 10 a.m. to 6 p.m. Like I stated earlier, we deploy to all 5 boroughs. We could deploy to somebody's home. If the individual don't feel comfortable meeting in the house, we can meet at a park, at a Starbucks, at a library, at a bus stop, wherever they feel comfortable. We have that flexibility, which is amazing. All right. Each team consists of a Department of Health and Mental Hygiene Behavioral Health professional and 2 NYPD officers. So yes, we do have an NYPD car. It is 2 police officers in uniform, and it is Department of Health and Mental Hygiene clinician sitting in the back in the car with us. We work together as a team collectively, which is amazing. And our team offers time-limited crisis intervention and support, including clinical assessment, supportive counseling, de-escalation, referral, and navigation to services. So that's our model. We just want people to get connected. We want people to be good in the community, and we are here for them. We are short term, but we're always there in the sense of if we meet, we assess, and we connect. Yes, we step back, but in the event that individual would like to speak to us again, we could always come back and reopen a case, which is amazing. All right. I am going to pass the torch to Veronica, who is going to speak about our triage desk. Veronica?
Thank you, Detective Gallardo. Just want to piggyback off what Gallardo said. I think the unit, we work really well together. We work together all day, travel throughout the 5 boroughs. And the beauty about it is that you get both responses, right, in one team. So someone actually asked this question in the chat. So how do you make a referral? So all the referrals that come to co-response do get filtered through the crisis line, which would be 988, as Amber had spoken earlier. If you find you have an individual who meets the criteria that was described earlier, and you would feel like this is the most appropriate intervention, you would call 988 to submit that referral. That referral then gets submitted to our own internal triage desk, and we do our own processing of information. We want to make sure that we're not duplicating services. We want to make sure that they have the right intervention. We'll check to see if that individual may be connected to a treatment team, and by that I mean ACT, FACT, SHACT. Amber had touched upon that in her presentation, to make sure that we're not duplicating services, and to also reach out to that team to say, hi, this person has come under our radar, has been brought to our attention because of X, Y reason, and make sure that they're aware that these incidents have occurred. And if they need any support, that we're happy to also provide that support, because sometimes they might not be engaging with that ACT team and they may need that short intervention to reconnect them, to be that bridge, that mediator between the team and the client. So we're also happy to do that as well. It is a two-part process. So not only does it go through the Department of Health and Mental Hygiene, but we also do a check on the NYPD side. It is a very soft preliminary check, because as Detective Gallardo mentioned, our goal is not to arrest any individuals. The unit has been working for about 8.5 years. Actually, myself and Gallardo have been here since the very beginning. And we've never had an incident where we've had to take those legal actions. And we do what we can to avoid that, and work around that, so that we get the appropriate intervention for the client that's in crisis. We also will call the referral source. So if you call and make a referral for an individual, you will receive a call either from myself or someone in the triage desk or one of our coordinators asking for more information. We'll ask very specific information about the incident. We'll ask information about the timeline, because all those things are very important to know. We'll ask about the supports in place. We will also safety plan depending on what time we receive the referral and how quickly we can respond. Next slide, Detective. So aside from having options for mobile crisis team, for co-response team, there are other crisis response options in New York City. So we're briefly going to touch upon these, and two of them are Be Heard and New York Start. So Be Heard is the Behavioral Health Emergency Assistance Response Division team. Very long. It is the a new, more health approach to mental health crisis in New York City. There's also New York Start and CSIDD. You may be familiar with it. It is the New York Systemic Therapeutic Assessment, Resources, and Treatment. That is New York Start. And Crisis Service for Individuals with Intellectual and/or Developmental Disabilities, CSIDD, which is through the state's OPWDD. Next slide, Detective. Thank you. So Be Heard engages individuals that are experiencing a emergency mental health crisis, that require a more health-centered approach. All these calls are via 911 operators. So for you to receive a response from a Be Heard team, which consists of 2 paramedics and a mental health professional, you would have to call 911, and the 911 operator, based on the information that you provide, if they determine that that is the appropriate intervention, they will send a team of Be Heard, and they will engage the individual. The response window is very short. I don't want to speak to the exact time, but it's a short response time. And their goal is to do a more, as close to real-time assessment of an individual that's experiencing a crisis. The option for Be Heard are only for individuals 6 and up, and they do respond to calls from schools. They've made several responses to school. There's actually a link to their website on this slide. We're happy to actually send it separately if it's more beneficial to folks, so that you can get a bit more information about Be Heard. It is a health approach. It is a non-police approach, in response to individuals having a crisis that don't necessarily warrant the presence of a police interaction. Next slide, Detective. So New York Start. New York Start and CSIDD are response in a crisis prevention service for individuals that have both developmental disabilities or behavioral health needs. And it's not only just for the individual, but it's also for the families. So it's also support for the family members that are also learning how to navigate and manage this new system, right? It's a 24-hour, 7-day program. It is for only individuals that are OPWDD eligible. And the referrals would be made via a link that we also will share. It's important to know that for individuals that are in schools that have individual plans, that have IEPs with their children, you have a team within your school that would also assist with connecting you to these services. Because for individuals that require a much more elevated type of service, more intense treatment, OPWDD would find those individuals eligible, and they would be more eligible for these crisis programs, which are really important, especially when we're dealing with the DD population. We want to make sure that we have the appropriate intervention. And New York START has crisis teams that can respond to certain situations. But you first need to be eligible with OPWDD, be connected with them, and then you can also use that as another option for a crisis response to individuals in the community. Detective Gallardo, next slide. So I'm actually gonna hand it off to Detective Gallardo.
Hello. So I had the pleasure to speak to Christy for a month before this presentation, and I told her that I wanted to touch base on the neighborhood community coordinator officer. In the NYPD lingo, we don't use community coordinator. We call them NCOs, and I think that this is very, very important for everybody here to know. Because every precinct has an NCO team assigned to engage with members in the community. All right, they serve as a liaison between the police and the community, right? And NCOs spend all their working hours within the confines of their assigned area, actively engaging with local community members and residents. I'll move to the next slide and I'll speak a little bit in regards. So every precinct has NCOs officers. They are responsible. Their job, their tasked to go out there and interact with the community, address quality of life concerns that you guys report, right? But most importantly, and we always get referrals from NCOs, is that the NCOs and you guys as parents, you guys can have a relationship. You guys can physically, call them, you can email them, which I will share in a minute, and explain to them things that are going on in your community, and you can actually bring things up that is going on in your home, right? Like there has been parents that told me like, hey, listen, I have a very good rapport with my NCO, and and I express to them, if they ever hear anything over the radio, if I ever call 911, just keep in mind that that's me. This is my address. I want to introduce myself. I've never had a really interaction with the police, but I kind of want to interact with you guys. So NCOs are the officers that are there to be that support for you guys in your community. All right. They host a community councils meeting that takes place monthly in their precinct, which is great. If you guys are interested in attending these meetings, please feel free to contact your NCO to obtain that information. Also, feel free to email your officers directly or contact your local precincts to discuss any quality of life questions or issue. Very briefly, I will tell you how to get that information. Okay. If you go to google.com, correct, and in the search engine, you put your precinct, just your precinct, 13th precinct, right? There's going to be a tab that comes up on the top that says 13th precinct nyc.gov, and this will come up. Okay, so next slide. Something like this will come up. It will say get to know your neighborhood coordinator officer. It will give you the sergeant, which is the supervisor's email, and every police officer that is assigned to your precinct. And I personally have friends that are assigned to the NCO role in the precinct, and they're always constantly interacting with members in the community. So definitely feel free to Google your precinct and contact any of your NCOs that are assigned to your precinct. In the side where it says community council, it will tell you who's the president. It will tell you in the bottom when the community council meetings typically take place. I believe this is for the 13th precinct. So if anybody lives in the 13th precinct, here you go. All right. So in the 13th precinct, the community council meeting is held on the second Wednesday of each month at 7 p.m. At the precinct, which is very, very good to know. So you guys will know that if you guys want to attend these community council meeting, you can just go to the precinct in this particular precinct on the second Wednesday of each month. So please do not be afraid. Please feel free to contact them. They are there to answer your questions. They are there to, if they have to meet with you guys, they will go and meet with you guys. And they are there to establish a relationship, which is very, very important. I'm going to pass this next slide to Commissioner Brooker. The floor is yours.
Thank you. A couple of points and clarifications that I want to make, and I'm going to start with Amber, who is talking about higher level and lower level needs. The thing about co-response, and I think Detective Gallardo touched on it as well, is in order to have a police officer show up with a mental health clinician, that means that there's something going on in that incident where there's some sort of violence or there may be a weapon involved. So it's a higher level call than being in distress. So I want to make that clarification. If Amber and her team, if NYC98 refer a call to us, that means that one of those factors is present already. So that's a big clarification, is co-response isn't going to show up because someone in the house is distressed. It's because, you know, someone reported some level of danger, but that danger hasn't reached the level of imminent risk. You know, I sometimes say, you know, the person in the household is on a 7 versus a 10 versus a 2. And so I wanted to just be very clear about that. The nice thing about that in terms of understanding the crisis response system is that we can step things up and we can step things down. You know, so we could come to the house and say, oh, you know, this doesn't, again, need law enforcement as well as a mental health clinician. Let's see what is also available. The other thing I want to say about 988 is we've probably used this word so much, we like it a lot. They're amazing at being able to funnel things to the right place. And they do have a capacity to take a call and move it to 911. And so, you know, you should know that they have that pathway. 911 at this point is not funneling to 988, but they can most certainly assess a call and say, you know what, we need to get help to you immediately. So those are just some clarifications that I wanted to make. Someone in the chat said something about, you know, hey, we're parents, you know, we need to be active and participating in partners. And Gallardo really, with the NCO program, there's nothing like being known to your local precinct. And that's against anything that we can think of. It's like, police don't need to know who I am. But when we have individuals that we love that are coming in contact with or that have symptoms that mean that some system is going to need to be deployed to keep everyone safe, then you do want to be known, right? And so when you're calling 911, there's a couple things I want you to think about. This information comes from, you know, the Organization on Autism Research. And, you know, I would say it's things that we've learned and know. To the extent that it's possible, when you're making that call, calmness is a critical part of that call. And I know that there's time and things unfold quickly, and we're going to talk, you know, in a couple of weeks about safety planning. And Amber, thank you for sharing the safety planning app. But if the entire household is in crisis, in that crisis, that makes it much more difficult. When you call 911, provide those specific details. Not, you know, I have this person and he's really upset. I have a child here who is on the spectrum. You know, sometimes he gets upset. He's really upset right now. You know your kids better than anyone. If you can say, you know, when one of these episodes happens, it lasts for 15 minutes so that people can start to wrap their heads around the behaviors that they're seeing. If that child has a diagnosis, to the extent that you're comfortable, share it because it provides context for people that are responding to the scenario. I'm calling, my child has autism. He is usually fairly calm. Right now, he's having an episode. You know, these episodes last about 20 to 30 minutes, but when he's having it, you know, he often rocks or he often throws things so that people know what kind of environment and situation they're walking into. Be comfortable talking about their triggers. One thing that really triggers my child is a lot of noise. Okay, so if 4 officers show up and all of the radios are blaring and the TV is, how can we help you control that environment where we can get the best possible outcome? You want to convey that information when you're calling 911, and you want to try to convey that information again once the officers are on the scene. So everyone has that information available to act. I'm big about the sensory issues. You know, if I am moving towards your child and that person does not like to be touched, everyone should not be figuring that out at that moment. So to the extent that you're able to convey information, say, you know, one of the things is touching him. If you continue to talk to him, especially in this tone of voice, he may respond better. Because what compliance means to one person looks very different for another and means something completely different to someone who has cognitive disabilities or is on the spectrum. So information sharing is critical. Sometimes situations happen quickly, and the parent is in the middle of it. If there is another adult that is present, you know, arm that adult with that information so they can be passing information back and forth. Because usually if there's a call to 911 that involves, you know, violence or aggression, you know, these things being subjective or a weapon, the supervisor is also going to show up for the NYPD. So as long as you have another adult there, they can help convey that information to the team. So as I don't know who said it in the chat, there is partnering with teams, there's partnering with the police, there's partnering in the endeavor to the extent that you're, you know, that you can. And so, you know, just wanted to give you some of those tidbits to be thinking about. The big thing is it a 10? Is it a 7? Or is it a 2? And then, am I comfortable? Do I have a script? To Amber's point, do I have a plan about what I need to convey when we find ourselves in a crisis that requires a police response? I think that to me is a great point to just circle back to Amber, you know, in terms of anything that you want to add before we open the floor for questions.
The only thing I wanted to add is just like Dr. Booker said, 988 will stay on the line while you call 911 if that is determined to be the appropriate intervention. So if you need that support, if you need like a trained counselor to help make that call with you, we're always available to help do that. Obviously, if it's safe, right? Obviously, you know, if you can't wait through explaining to a 988 person what's going on, you know, then you would want to call 911 directly. But if you need that support or you're not sure if you need 911, please always feel free to give us a call and we can help just make that call go a little bit easier and give that additional support in that moment.
Thank you. President Angel, are you on? Do you want to turn it over? I'm going to turn it.
I am on. Thank you guys so much. Like, you don't understand how life-changing this is to give the information to our parents, because 911 is scary, you know, and just getting this information to be able to make informed decisions really empowers our care managers, our parents, our family members, our guardians. With that being said, I'm going to drop into the chat to see the questions that have been asked thus far. Let me start at the top. 1 second. Detective Gallardo, I think this might be for you. We might have 2 for you. How can we send referrals to this unit instead of calling 911?
So it's important. That's a good question. It's important that you guys understand that NYC 988 is the central hub. All right. So you guys will call 988. You guys will pick up your phone, call 988, go through the assessment question, and the 988 counselor will make the determination if that particular what you guys are describing, if that's suitable for call response. All right. So at the ending of the day, you still have to go through 988 in order for a referral to come to us. Am I right, Amber?
I have a secondary question before Ms. Trinkle responds. It
Okay.
says, would you have your care manager send in the referral for co-response, be heard, and NSSID with YAI?
Can you repeat that question? I'm sorry.
Would you have your care manager send in the referral for co-response, be heard, and NSSID with YAI?
Go ahead, Commissioner.
I think that's a great question because it helps us explain the different levels, and Amber is going to jump in here. To raise the OPWDD crisis is one thing, which does not involve NYC per se. And that's going to be on an established relationship because you're OPWDD designated or eligible. That's that piece of it. A be heard is going to come to you because it's a mental health call that doesn't have violence or a weapon, because they're being dispatched in your area of town or within the precinct that you belong to. But that is a complete 911 call. That's not going to go through Amber and NYC 988. That's a straight 911 call. And then certainly last but not least is that co-response call, which is the emphasis is post-crisis or pre-crisis, which means there is no imminent harm in that household at that moment. Whatever the situation is, it can, everything's okay for the next 24 to 48 hours. So something like suicidality, active suicidality, that's 911. Aggression where you think you're going to be harmed or someone in the house or your child is going to be harmed, that's 911. So I just want to make sure that we're clear on those pathways and the time constraints. Imminent harm, it's still 911. After that call, you can call us right away and we're happy to follow up. But if there's imminent risk, it's 911. If be heard is in the area where you're making that call, you may get a be heard response. And you can ask, is be heard available in this area? So that even the call taker is thinking about, oh, let's see if we can dispatch be heard to this scenario. Is that fair? Is that Amber?
Yeah, that's definitely fair. And something you'll notice if you are calling for a CRT, a co-response referral with NYC 988, is we are always going to assess is co-response needed, is mobile crisis needed, is children's mobile crisis needed, right? We're really going to go through to try to figure out which team is the most appropriate to make sure that whoever's giving you support is the most appropriate team for your family, right? So someone under 18, we would be looking at the children's teams just because they specialize with working with children, right? Where co-response doesn't work with people under 18, right? For our clients over 18, right? We would be looking between mobile crisis and co-response depending on that presence of, if there's a safety risk, right? If we need the police presence or if the team themselves of just a traditional mobile crisis team would be able to respond without the police presence.
Ms. Trinkle, there's a follow-up question. You did answer it in the chat, but I was wondering if you would answer it out loud. It said, what is the process for a call with a person expressing suicide ideation? How is that handled? This is from the chart presented on the type and the percentage of calls.
Yeah, so I think that's a great question. So whenever there is suicidal ideation endorsed, our crisis counselors are going to take some additional time to assess, right? So they're going to explore what specifically is going on, right? What is the ideation? Is there any kind of plan, intent, time frame on this concern, right? If the client themselves is on the phone, so if your child is there and can join the call, or if it's something you're experiencing, the counselor is going to try to to provide support, including identifying coping skills, making a safety plan, figuring out how to keep you safe in that moment, right? If the situation is, if you're able to remain safe, if the child or the person of concern is able to remain safe, and the suicidal ideation is passive, we're going to look at referrals, safety plans, possibly MCT or co-response, depending on the specific situation. If somebody is an imminent risk, right? So that would mean that there's a plan or there's intent or there's a reason to think they can't be safe before that service can come out. We will start talking about, you know, is there a CPAP near you that the person would be able to be brought to, or is EMS needed? And in that situation where there is imminent risk, if EMS is needed, that crisis council will make that call with you, and they will call 911 and make that with you, unless you're a provider. Sometimes providers at that point may decide like they feel comfortable making that call by themselves, in which case that's totally okay. But we will always offer to do that with you.
Thank you so much. In reading the next question, I'm going to give this to Commissioner Dr. Brooker. How can we make a big push for many that do not know about this as flyers are approved? How can we share them? You're muted.
I'm going to share this answer with Amber. You know, NYC 988 really emerged as with these additional sort of bells and whistles in the last year and a half. And so I'm now we are all as a community starting to see NYC 988 everywhere in advertisements and things of that nature. If you are a provider or an organization, on their website, they actually have marketing materials, right? That you can print that is, you know, official information. And so I think that that's the important part. I think for NYPD and just the crisis continuum, we have to get together more and tell you these things, and build websites that explain the system, because it's changed in the last year and a half, right? There's Be Heard. I mean, co-response has been around. There's different teams at the state level, city level. And so I think for us, for the working group, it's how do we explain that to just everyday Joe, everyday person? And that's work for us to do, and work that you guys need to push us to do, if I can be political for a second.
I will jump into the political part.
Okay. Okay.
As I am a community member of District 75. I'm here to serve. And I will say the only reason I know about the co-response team in these different spaces is because of what I went through with my own child.
Mhm.
And my BCBA, who is not on the call any longer, she had to drop for 3 o'clock, Dr. Rebecca Wright, is who introduced me to all of these different spaces. And I will say Detective Gallardo and Commissioner Dr. Brucker has really expanded my knowledge. And I want to make sure that all of us who are a village together, that we know this information, that we spread it out. I will make sure to download the information that we need at our CCD75 Council for outreach. And I will bounce that back to Commissioner Brooker to make sure that everything is in line with the messaging that we do want to send out. With that being said, there is another question, and I'm going to hit the Detective Gallardo with this one. How do we locate our local NCOs?
That's a very good question. So you could walk into your precinct, and so when you walk into a precinct, there's a police officer that is at the desk. You can ask him to if your NCOs are actually present, or Christy, I saw that you posted the link. I saw that you did post a link. If you press that link and you search your precinct, they'll give you a list of all the emails of every NCO that is assigned to that precinct, and you could feel free to just email them. All right, and they will answer you at a timely manner. All right, so you could definitely, don't be afraid to walk in there. You could definitely walk in there and be like, listen, I want to speak to my local NCO, and I want to just introduce myself, and feel free, and they will, if they're there, they'll bring them down so you guys can meet them for sure.
Are you able to speak more to, outside of the NCOs, there's something that I came across that I wasn't aware of. We have something called Build a Block. That we get to work with our NYPD, our NCOs, and things of that nature. Can you explain or a little bit about what that may be? We'll give additional information.
Gotcha. Christy, I'm gonna be 100% honest with you. In regards to Build a Block, I'm not too, I don't know much about Build a Block. Can you?
I can. I'll jump in to
Okay,
help. And then I saw Amber raise her hand.
I don't want to give the wrong information.
No, and I'm only going to give a little bit that I know.
Mhm.
I know that if you follow the directions that the detective gave us and you get to your NCO website, there is something called Build a Block. And it is very close to you, just like you're voting. You can walk to whatever location that they have. You can get to know your officers, and you can share your concerns, considerations, and be a part of what's going on in your community. With our children that have special needs, just like the fire department or anyone else, we want them to know who our kids are. We want them to know where we live and what we have going on, because that lowers the stress of what we have going on when we need to call. And they are great partners. I myself, as an example, I've had to call before. I've had 2 officers follow up with me, give me their phone number, give me their cards. They did not make me feel bad about anything. It's at this point, I feel grateful that I can call in and that my precinct knows me, that NYPD knows me, and I don't have to have a level of fear, because as our children get older, we may say, oh, they're 18, they could go to jail, or they could be prosecuted, or they can, no. Bring it down and know that these sources are here for you to help you and our children and our adults and our population. Additionally, I wanted to ask, I have several people who would like to have the PDFs that were presented. Is that something that we will be able to share out, or?
For the PD side, what we'll do is we'll send you a copy of our pamphlet.
Yes.
Which pretty much covers everything that we just talked about. I also put in the chat the Build a Block hyperlink, so you can connect right to the website for Build the Block.
Thank you.
And it'll direct you to, where you need to go. Don't want to be preachy at all, but I think, Christy, you're absolutely right. It's like, get to know your police officers. That is just the best part of this process, because yeah, there's lots of stuff in the universe, but meeting someone face to face is the best way to reduce some of that fear, and being known and knowing that someone can say, hey, Christy, how are you doing? And building those relationships so that when we get to those critical moments, that there's a level of trust that can be exchanged between the 2 parties, within the incident.
And trust is the most major part, because we've lost a little bit of trust. And I can say, as a parent, with the conversations I've been having for months with the commissioner, with Detective Gallardo, I feel good. I feel really good. I feel more safe than I felt before, because I'm making informed decisions.
Yeah.
With that being said, I do see that someone said, if someone is in OPWDD, can they still get help from CSIDD? My response would be yes to that. Amber, would you like to piggyback on CSSID and OPWDD? If not, it's okay. We did have a CSIDD meeting. I can share that out in addition with this video and give everyone the information for our licensed social worker that will be working with us with crisis. With that being said, we do have workshops that are coming up to model frustration processes and calming techniques. That's on August 7th. And to piggyback this meeting, we are going to have a mental health crisis planning workshop on August 12th, where Commissioner Dr. Brooker will be leading the point on that. So we will not leave you hanging. We will continue to give you information and support. If you do not have a question answered from here, please do email the council, d75council@schools.nyc.gov. We have given the information for Commissioner Dr. Brooker and for Detective Gallardo. Ms. Trinkle, we can also, Ms. Alea and Ms. Trinkle, we can put your information in as well, just so we keep our communities engaged with you. Absolutely. Also, I see someone asked, how can my organization partner with NYC 988?
That's a great question. You would just want to reach out and we can talk through what that partnership would look like. We do presentations to individual organizations. So if you have like an agency or something that you would like a presentation, we can always do that. But you would just reach out. You could reach out to myself and I could help direct you to who would be appropriate based on your organization and what you're looking for. And I'll put my contact information in the chat.
Thank you so much, Ms. Trinkle. With that, I have exhausted the questions that are in the chat, but I know more things will come in. And again, as I said, we do have a follow-up meeting that will be on August 12th. I do want to say thank you again, Commissioner Brooker. Thank you, Ms. Olea. Thank you, Ms. Trinkle. Thank you, Detective Gallardo. Christian says thank you. I know how important this is for our community, so I thank you for your time, your consideration, and your partnership. With that being said, I just want to give the floor back to our presenters for any last questions or concerns or information that you would like to give us.
I'm always muted. I just want to say thank you and thank you and to just continue this conversation. You know, this is a partnership. You all are the experts on everyone that lives in your household. And we're really here just to move you through different levels of things that happen, good, bad, or indifferent. And so thank you for inviting us, Christy. We appreciate it. We are here for you. If there are other questions that come up that are posed, please come back to us and we'll definitely be here to answer those questions. Thank you, Amber, Director Olaya, Detective Gallardo, as she says it best. And then thank you to Sergeant Taylor, our triage sergeant has been quietly listening. And with that, we're just available. You have our contact information. Do not hesitate.
Thank you so much. I do want to also make reference, our co-president, Andrea Daniels, is also online supporting us, and our vice president, who is also my co-chair, Christy Montavon, is also online supporting us, and they will continue to be with us in these efforts as we move forward to give continued information. Dr. Commissioner Brooker, I will follow up with you so that I may go ahead and release the flyer and we can get more parents in as we continue this effort. Again, I want to say thank you guys from the bottom of my heart, because I know what it means for this information for people. It changes lives and it creates partnerships and it changes how we view help. So I just want to say thank you, and we will be talking soon. Are there any further questions? I know I didn't reach out to the Spanish, Bangla, and Mandarin. Can we please check in with those audiences to see if we have any additional questions?
No question from Bengali.
Okay, no questions from Bangla. I see no questions from Mandarin. Do we have any questions from Spanish? Nothing from Spanish. Okay, thank you so much. With that being said, I am going to give your day back to you. I appreciate you so very much. We are now releasing our interpreters at 3:30 p.m. If we do have any further questions or concerns, again, please do email the council at d75council@schools.nyc.gov. And we do look forward to seeing you at our next meeting. And thank you, presenters, again, Commissioner Brooker, Detective Gallardo, Mrs. Olea, and Mrs. Trinkle. We appreciate you, and we will be in touch and stay in touch. Thank you so much again. Everyone have an amazing day.